The patient's needs are first assessed, evaluating his level of hair loss to determine the amount and number of grafts he will require to cover that zone. Each patient is different, and each case must be evaluated as an individual case. The hairline is positioned in what would be a normal male pattern with frontotemporal recessions retained, being very careful not to blunt the angles, which are normal in the adult male. Typically, a central zone, referred to as the frontal tuft, is also designed because in normal males this area retains the maximum density, so we will try to mimic exactly what nature has in all of us, and that is an area of maximum density in the front central zone as we restore the hair, with a lesser density to either side. This is normal and natural, and we wish for the final product, when completed, to look very similar to what was there originally. The donor area is selected in the back, choosing the hair that typically provides us the best and most numerous. As you can see, this young man has a very sizable density of over 100 follicular units and about 300 hair per square centimeter, which is a very substantial density. In order to determine exactly the number of hair and the number of grafts he is going to produce per square centimeter, we will count under magnification 4 separate sites along his donor area, determining thereby the number of hair and the number of grafts he will produce per square centimeter. This allows us to determine the size of surface area we will need to remove in order to accomplish or to obtain enough hair to cover the area we're going to need to cover. A template giving us the number of hair and number of grafts we will need is then placed and drawn carefully in place. After the surface area required to accomplish the number of grafts we need, this is slowly anesthetized. This is not an uncomfortable part of the procedure at all if the injection is done in a slow fashion and gently massaged in place. Typically, there is no significant discomfort associated with the injection of the anesthetic. The area is then prepped in sterile surgical fashion in preparation for the removal of the donor area. The removal is done with a single-bladed knife in order to avoid transecting any more hair follicles than is absolutely natural. As you will note, I am carefully removing the donor area, watching very carefully the direction of growth of the hair so that I do not transect hair follicles at the margin of the incision any more than is absolutely necessary. Typically, we will have a transection rate of no more than about 2% of all the follicles present during the removal process. The donor ellipse is carefully elevated and removed through the fatty layer of the skin. The skin margins are then joined together with a small instrument called a towel clip and held in place until holding sutures can be placed. After placing 2 or 3 of these holding sutures and 2 or 3 deep stitches for strength to the wound, the final skin margin is accomplished with a set of surface stitches. And this will close, as you can see here, very neatly into a narrow straight line, which will be covered entirely by the overlying hair, disguising therefore the removal site rather completely. The frontal area is likewise anesthetized by slowly injecting local anesthetic until that is totally numb. This represents the donor tissue, in this particular case about 10 square centimeters of surface area containing about 3,000 hair and slightly over 1,000 grafts. This is an unusually dense case. That is, there are a lot of hair per square centimeter in this particular donor tissue. As you can see it under magnification, after the donor tissue is blocked, hair grows from the surface of our skin, not as a single hair most of the time, but actually as groupings of 1, 2, 3, 4, and rarely 5 hair. These small groupings are referred to as follicular units. They're sort of like little families of hair that grow out of the surface very close together, leaving a sizable amount of ball skin between them. We do not need to plant the ball skin, but we do need to plant the hair follicles. This is accomplished by slowly dividing the donor tissue carefully under high power microscopic magnification, utilizing a razor blade and a small jeweler's forceps. We apply traction in one direction with the jeweler's forceps and traction in the opposite direction with the flat side of the razor blade as we transect through between the follicles, being very careful, as you can see, to avoid cutting or transecting any of these hair follicles, so that they're all preserved totally intact from their surface to their bulb for a reimplantation in the bald zone. These small segments of tissue are referred to as slivers, and they may be from 1 to 2 or sometimes even 3 rows of follicular units in width. As you can see, this particular sliver contains basically 2 rows of follicular units. These will be dissected into individual grafts after the slivers are totally performed or totally generated from the donor tissue. We're now dealing with a sliver which is going to be transected into individual grafts until we have each follicular unit present by itself, representing a graft that will be restored into the area and containing from 1 to 4 hair. Obviously, the single hair grafts will be placed at the front edge so that we retain an extremely natural appearance to the frontal hairline, and the grafts that contain more than 1 hair will be placed farther back to allow for the creation of natural density, the gradient of natural density present in everyone's scalp. As you can see, I'm carefully dissecting between each of these follicular units and doing so without transecting any of the hair. A skilled assistant can accomplish this by transecting well under 1% of all hair that are present. After we've got the grafts divided up into units, they are then carefully trimmed of all excess tissue. Remember that we're planting hair, not connective tissue or fat or other tissues. We wish these grafts to be reasonably well trimmed so that they can be placed close together. The smaller the graft, obviously, the closer one is able to place them to each other during the grafting process. Again, I'm going through the trimming process, removing from the graft any tissue that does not effectively bear a hair follicle. This tissue, if grafted, will simply cause the grafts to be spread further apart, and we would prefer that not to happen because we would like to accomplish with a single pass or a single session a respectable coverage of the area to be grafted, that is the bald area of the scalp, such that if the individual does not wish to do any other grafting, he does not have to do so. This particular view demonstrates grafts on each end which are carefully trimmed, neatly trimmed, compared to 2 grafts in the center which are not trimmed. These are sometimes referred to as chunky grafts, those in the center, as opposed to those on the sides which are much more closely trimmed. And you can determine quite quickly that it's much easier to place the trimmed graft closely together. The grafts are then divided into groupings of 1s, 2s, and the 3s and 4s typically together. As you can see, this is a stack of grafts that contain only a single hair each. These will be placed at the frontal hairline and in a staggered fashion so that the frontal hairline is soft and natural and undetectable. These are the 2 hair grafts, which will be placed slightly behind the 1 hair grafts, and finally these are the 3 and 4 hair grafts, which will be placed in the center frontal tuft for density and behind the other grafts to accomplish additional density. This particular session shows our assistant placing the grafts into the frontal tuft. An 18 gauge, an 18, 19, or 20 gauge needle, which is a relatively small needle, is utilized to make a tunnel in the skin, and when the needle is removed, the graft is gently inserted into the needle tunnel created. This process is repeated over and over and over again until the area is thoroughly covered with grafts as tightly as we can pack them together to create both density and naturalness. As you can see, the assistant handles these grafts carefully and gently, placing each one of them in the hole with the least amount of manipulation possible. The assistant in this particular film is placing grafts at a concentration of approximately 20 to 25 grafts per square centimeter, which is going to produce a hair density, in this instance in the frontal tuft, of somewhere around 60 to 75 hair per square centimeter, which is quite excellent. Finally, at the completion of the procedure, this is what the grafted area will look like. Single hair grafts placed at the front in an irregular fashion to give a very natural, soft frontal hairline. 2 and 3 hair grafts or 4 hair grafts placed in the frontal tuft to create density, and then additional grafts placed behind to complete the process. You may allow this to go dry, or you may wish to place a dressing, as we're doing in this case, over the area in order to hasten healing. Dressings shorten the healing rate to about 4 to 6 days as compared to the dry method, which will take a week to 10 days. After placement of the dressing, a cap is placed and the patient is discharged to begin handling his hair and his grafts in a normal fashion in 7 days.